Hello folks, I'm Dean Curry, president and founder of Massage Terrific. We are an in-home massage service based right out of here in New York City. I get asked a lot of different questions about various types of massage, myriad types of massage. And a lot of people have heard terms before, but they're not quite familiar or understand the process of some of these massage specificities. And I always feel a need to sort of not just make videos of me actually doing massage, because of course it's a lot harder to do a massage and concentrate on a massage while you're speaking to a live audience. So a lot of times I'd like to talk in theory, what have you, for ways that I could explain massage on a more theoretical plane level, so each and every person could understand more or less what it's about in theory rather than in actual physical practice. And don't get me wrong, I will have a lot of videos of massage, coming up where I'm actually doing massage and speaking at the same time and those types of things. And those are great, and they're all set up for a little bit later in the year. I've been focusing more on the theory of massage, the history of massage, where it comes from, speaking in terms of theory, of practice, what certain specificities of massage actually do, and what they pertain to, or what type of conditions they actually help with. And one thing that I noticed a lot here on our YouTube channel and podcast for Massage Terrific, but I've noticed a lot with actual videos, and they're all very good. There's a lot of physical videos for massage, but there isn't a whole lot of explaining. And a lot of times, when I get asked as president and founder of Massage Terrific, I get asked questions about massage. It isn't, can you show me a certain specificity of massage or a certain mode of massage? Can you show me craniosacral therapy? Can you show me Swedish massage? They're not really asking me that. What they're asking me more often than not is, what does that specific type of massage, what does it do? What are the benefits? What are, how is it developed? How does it apply to certain conditions? A certain condition I'm having, these types of things. And so I really am spending the next several months really trying to explain certain modes of massage, certain different, types of massage. I say massage because people understand that, but, when I say craniosacral, it isn't really craniosacral massage, it's a craniosacral technique. I say craniosacral massage so people that are established in the field and experienced don't use the asterisk or the ending massage to craniosacral. It's usually craniosacral technique, and that applies to things like polarity. They don't use polarity massage, but on these videos I'll say polarity massage because not everyone has been trained in massage and went to a certain level of experience in massage. I myself attended the Swedish Institute, fantastic institution. They wear white jackets. It's not 3 months, it's not 6 months, it's 2 years, and they basically go over every type of massage you want to learn about, whether it be deep tissue massage or craniosacral massage or shiatsu. These are combining, let's say, the Western and Eastern philosophies of massage. A lot of the massage techniques have come from more Eastern type of nations, countries, Egypt, China, India, Japan, different things like that, Thailand. And they have migrated, if you will, throughout the years. Just give you a little history. Migrated throughout the years to different geographical areas all over the United States, all over North America, European nations, so on and so forth. And sometimes when I speak in more layman's terms. So the novice or people that have not received the diverse, experience could kind of understand what's going on, and their theories of massage may not be as comprehensive, if you will. So I speak in more simple terms so everyone could understand and learn. I say that, for a lot of different myriad of reasons. Anyway, so moving right along, one of the areas of massage is probably one of my favorites, one I do a lot of in geriatric home care, because as people get advanced in chronological age, they most certainly, can't take the physical application of certain types of massage, and you have to, back up and use more advanced, clever, experienced ways to deal with certain medical conditions they might be having, and that's where things like cranial sacral massage, polarity massage, it's not as intense, and you can use those types of massage or techniques, if you will, in geriatric care when someone might have advanced osteoporosis, rheumatoid arthritis, things where the hard application of physical massage may be just too unbearable for them. One of the other types of massage or technique, if you will, I'll call it massage for now, that is probably one of my favorites, and with the geriatric home care that I do with people advanced in age that do have osteoporosis or rheumatoid arthritis, and they just can't take the physical, intentions of more applied pressure, we tend to use things like reflexology. And it's one of my favorites, one that I'm studying and continue to study a great deal in. And it's a very advanced theory dating back to more or less, I guess, Egypt, or China, where some of the early teachings of reflexology are. Simply stated, reflexology is done on the hands and the feet. And it is used where there are nerve endings throughout the extremities, meaning the arms and legs, and there are nerve endings that transfer into the arms, into the hands, through the legs, into the feet, that more or less have a reflex connection to various organs or systems throughout the body. Which makes sense. The body is connected. It's not disjointed. It's not separated. And there are certain organs, whether it be the kidney or the liver or the gallbladder, where they have nerve endings that stretch from the organs or from the body systems into certain areas of the extremities, the far hands and feet, where applying pressure on various parts of the hands and feet will actually relieve certain pain, discomfort, blockages that you are actually experiencing in the kidney, in the liver, in the stomach, in the back. Now, why is that important? Well, it's important for a lot of reasons. One I brought up to you was geriatric care. And in geriatric care, when you're dealing with, let's say, a client, without divulging information, if you're dealing with someone with severe rheumatoid arthritis, osteoporosis, one of my clients, blockages in the digestive system, especially in the ascending colon and the descending colon, the body, if I step back a little, ascends here on the right side, goes across horizontally, and then descends, and then you have a bowel movement. And it's very important to have a client that has severe pain in her colon and stomach area. And although we do some type of circulatory light pressure and shiatsu, which is more Eastern and hovering, more Eastern philosophy type of movements instead of physical movements on the actual colon. Most things I do around the stomach area are very topical, surface-based, if you will. And I try to use different techniques like reflexology, where I can still work on the stomach and I could still work on the spleen, which filters blood. She has a lot of pain up in her spleen. The pancreas, the gallbladder, the liver, especially, we call the liver the master planner because it basically decides where everything goes and shifts it left to right throughout the body systems and different canals and different passageways. And you have the gallbladder, very, very important in filtering what the body needs and not, with bile, transferring toxic bile to non-toxic bile, which, for myself is actually a step. Not too long ago, when I was in school, I realized I have a condition called Gilbert syndrome. It's French, I guess the name, and it's something that's undetected. And you receive the gene from your parents. It could cause jaundice and things like that, especially when young. Or if you're extremely stressed or if you're extremely tired, it actually has a problem transferring more or less elevated, bile levels in your body. Your body has a little bit of a harder time. It's not a major condition, very manageable if you eat right and keep your stress level down. It basically is a condition that disallows you from transferring toxic bile to non-toxic bile, which is important to eliminate it in a bowel movement through your body. And that's more or less really important, because if your body is not transferring toxic bile to non-toxic, it is staying toxic in your body and could cause a lot of issues. And when I was in school, I'm always in school learning and researching. I wasn't getting the sleep I needed, or the rest, or I didn't have as much time to exercise. It was a really hard course I was taking and lack of sleep. And it spiked on me, and they thought it was something actually worse, and they realized that I had this condition I never knew about. So now I always make sure I keep my levels of stress down. I get sleep. I don't overwork, and things like that, and it hasn't been an issue ever since. But these are the type of conditions that can be worked on, with the hands and the feet. I can't show you my feet right now. But more or less, reflexology is, the systems on your left side of the body, whether they be the spleen, the liver, kind of transfers to both, pancreas, things of that nature, the heart, are more towards left and center, the build of the body, and then you have the gallbladder and other organs sort of on the right. So when you think of reflexology, you think of working on nerve endings in the hands and the feet that apply to the left side of the body for the left hand and the right side of the body for the right hand. And the same thing with the feet. The left foot will deal with the organs, whether they be the spleen or certain parts of the stomach, if you're having a digestive condition, or if you're having issues with the pancreas. The liver can actually be worked on both hands and both feet, but different parts of the liver come into play where it's might be a little bit more left-based than right-based, but you could work on both. And, when you push on certain aspects of the hand, or, the back of the hand, or, feet in reflexology, it applies more or less to various types. For the hands, simply said, think of the body as being top to bottom. So if you think of the head, it would be geared more towards the tops of the fingers. And as it moves down the body, it gets into the lungs. When you get to, you know, I guess the top part of the hand, not the fingers, the top part of the actual flat surface hand, you're getting into the lungs, the heart, the chest, and then when you go lower into sort of the middle of the palm, you know, you're getting, especially on the left hand, you're getting the liver. The spleen is more towards the outside of the hand. So when you push on those areas, and the tension is more of a sink, it's not a push. You're kind of sinking into those areas. Some people use the thumbs to push in those areas. I'm not a huge fan of that, and I've gotten real good at through the years of using the bottom part of my hand to actually, you know, push into those areas. And you know, this is what reflexologists do. They, you know, everyone kind of has a different technique, and each one works for them. I sort of like the base of the bottom of the hand to push into various points on the hands. Rather than a less broad or narrow thumb to push in there, and I find it's easier to sink in using a broader base, which has a larger connected bone too. So I just feel it's more balanced that way. But I use my fingers for different things as well in reflexology. But in the hands, it's really very simple. As you go down, you're going kind of down into the different parts of the system. So, you know, the liver would kind of be in the vast area of the palm, kind of, you know, in there towards the middle of the hand. And, you know, as you go a little further, you're getting down into the stomach and, you know, the small intestines towards the base of the hand. And unlike the feet, where you can reach almost the whole body from, you know, a large part of the bottom of the foot, with the hands, it's a little different. When you get into the legs and the lower extremities, it's usually you turn the you know, the hand over and you hit the back part of the hand to, I guess, more or less hit. You know, I'm not going to explain every single organ on the hand, that would take too long. And, you know, I'm trying to be more historical and theoretical in this approach. But as you get towards the back and the lower back and, you know, the legs and hips and the lower extremities, you turn the hand over and you start to hit basically the back of the hand. And if you want to go to the right hand for the gallbladder and different parts of the liver, organs that are more on the right side, you can do that. But it's very effective because when you sink into these points, right, you are basically stimulating, or probably a better word, it's not the right word, but it's a word that will make sense to you. It basically releases certain tension or blockages or blocked energy in those areas by meeting those reflex points in the hand and in the feet. And there are different things that you can do in reflexology where you loosen the fingers, circulatory, and the hands. You could even jostle back and forth. And there are a lot of other techniques that go into reflexology. However, we're speaking more just about the tension and the connectivity of the organs and body systems, just so you kind of understand. And what does that do? It relieves pain. Okay, it could be migraine headaches. It could help create homogeneous, pardon me, there's homogeneous and homogeneous, the two different words. Homogeneous is more of a replica of genetic body tissue or organ. Homogeneous is more of a uniformity throughout the body. A lot of people use those words similarly, but they're actually different. And you know, probably an even better word, just off the top of my head, that might make more sense to you, is homeostasis, where you're reaching a balanced point within the body, and that would be balanced energy, balanced flow, circulatory, relief of pain. The Integrative Cancer Society did a study of people that had surgery with cancer and treatment and found that reflexology not too long ago actually was more effective in relieving the symptoms of cancer associated with cancer surgery and even application of other types of devices or treatments in cancer. It was more advantageous to people, which it's not as physical, and that kind of makes sense in relieving some pain and stress and anxiety associated with that, or just with a person experiencing strain, stress. But it can also relieve back pain. It could help with circulatory. I mean, I have a client, I work on her feet and hands in reflexology, and all of a sudden her stomach pain up in her spleen and up into the rib area, there's a lot of nerves in there, and she has issues with getting that last turn before you have a bowel movement and a descending colon, and she has a lot of issues and pain in there, and it's just too acute. And you have to know what you're doing with people of geriatric care. It's my specialty. Dealt with it a long time because you could injure them, And when it's really acute, meaning when it's really, the pain is severe, we do a lot of polarity. We do reflexology, where we work on the hands and feet, and we hit on the areas of the stomach, which is right above the center of the hand. And the large intestine, small intestines, which is a little lower in the hand, and all of a sudden her pain essentially goes away. And it's amazing. I mean, there's a lot of undiscovered research in reflexology. It's probably the one subject I do more than any other massage because of the geriatric care, and I do a lot of cranial sacral and polarity as well with geriatric care, because they can't take intense, massage and things like that. And reflexology is, I call it an undiscovered country, even though it's been around and ancient for years, going back to Egypt. There's not enough literature. It's why I make these videos. Not enough literature explaining, how it really works and the benefits of it. And people that do it get it. And people that receive the treatment get it. But the rest of the world, I feel, and this is subjectively speaking, I feel they just haven't, quite caught up. And that's why this is more of a theoretical type of, explanation, because I feel the need to teach people about the benefits of, relieving stress or relieving anxiety or insomnia or, any type of, system that's blocked in the system and needs to have a more indirect way of reaching those systems. In the feet, it's a little different because you could hit almost all, I guess we'll pretend my hand is my foot right now, or I'll just give you a visual by talking about it. The bottom of the feet, if you start at the top of the feet on the bottom, you are basically talking about the head cranial area, and as you move down to the ball of the feet, you're getting into the lungs, you're getting into the chest, the heart, and then as you move a little past the balls of the feet, right past the balls of the feet, before the arch actually starts to occur, or as the arch actually starts to occur, you start dealing with areas of, again, the left side of the foot bottom would apply to the spleen or the liver. You could actually hit the liver on both sides of the feet. The pancreas is on the left side. On the right side, you would have the gallbladder, and so on and so forth. So you would use the right foot. But the difference between the hands and feet in reflexology is you don't have to, even though you work on the tops of the feet as well for certain body systems and organs, you can hit most of the aspects of the body just on the bottom of the feet, but the bottom of the hand, or the inside of the hand, if you want to call it the plantar part versus the dorsal area, as we would say in medical terms. You are basically, with the feet, you're able to cover a bigger body surface. You could actually start from the head, from the top of the inside of the toes and the bottom part of the feet, and then get into the bladder and get into the, not the bladder, past the ball of the feet, you get into the intestines, and you get more into the large intestines, the colon. The heart is more above the top of the feet, and as you move down into the arch, you start getting into the liver and some of the large intestines. And as you get towards the end of the arch, before the heel, then you start getting into some of the areas of the middle section of the body. And then the sciatica comes right before the heel into the hips, where you push on a certain part of right before the heel of the foot on the underside of the foot, and you actually can relieve or release tension in the sciatica. I have a client that has severe sciatica, and when it acts up, it's difficult. I mean, we do sports approximation, we do a lot of topical stuff. I don't just not work on it. But things like reflexology are essential when you're dealing with acute conditions. And, it relieves, you push on the bottom of the foot and right before the heel, and it relieves the tension in the sciatica. And then, and lower back and back pain and things of that nature. And as you get to the heel, then you're getting, down into the lower extremities throughout the heel, and I guess the lower half of the body. It's a vast area, the heel, on the sides and front and back. So, you're basically hitting, a lot of different areas of the back and of the feet. I mean, there's many tools that are basically used with reflexology. There's, ball type instruments that are pushed in. There's brushes, there's dowels. I mean, they all have different names, and you more or less are getting into different areas of the different tools to get into different areas. And as far as historically here in the 1900s, you had William Fitzgerald basically come here with Eunice Ingram, and I guess they're the father, or of modern reflexology, and as it goes here in North America. But it really dates back to Europe and China, and it's really hard to credit one person or another bringing it here, because these things date back thousands of years. So this is more or less what reflexology is. How do the sessions work? They could be 30 to 60 minutes. Mine tend to be more 60 minutes. A lot of reflexologists don't use any type of cream or massage, or they use a drier cream, not a slippery cream or oil, because it's not really big. And some reflexologists might use oil, but I don't really use much oil. Sometimes I'll use more of a moisturizer, because it doesn't slide as much. And sometimes with with reflexology, you want a little give, but you don't want too much give, because some of the movements are firm, but you also want to have a little bit of grip, and that's why oil would not really work. But again, reflexologists are reflexologists, different people, different strokes for different folks. But that's more or less how it works. 30, 60 minutes, done with your clothes on. If you're ticklish, some people are ticklish in the hands and feet. I don't foresee that as an issue in reflexology, because the pressure, I wouldn't say is firm, but it's not light. Okay, and there is a certain amount of tension, and it's more of a pressing than well, I shouldn't say that, because certain aspects on the topical side is more sliding, which isn't as ticklish, and on the bottom side it might be a little bit more the application of pressure. But it's done with a certain amount of tension in it, where it shouldn't really be an issue of any type of ticklish, ness going on, but anyway, just made that up. But anyway, yeah, that's more or less reflexology. It's extremely effective, to add. A lot of times what I do is I'll perform a session with the person, and it may not just be reflexology. I rarely do that anymore. We might do a shiatsu session, which is more based towards Eastern type of massage, like reflexology, polarity. And even with Swedish massage, which is a deep tissue, sports massage or deep tissue massage, Swedish massage is more physical with the oils. I will probably throw in some shiatsu, reflexology, polarity. It'll be a mixture of everything, and I basically will sense and interview a client. It's very important, reflexology, the interview. I didn't really even get into that, but you have to interview to find out exactly what's going on there and ask questions about conditions and stuff like that. That goes without saying, no matter what the massage is. But, it's very, very important to have diversity in your strokes. And I explain this to clients because what I'll do is I'll notice different things during a session that will basically bring me to a specificity that I know will be more effective if I'm, for example, working on someone. I feel a certain type of tension that the mode that I'm doing, whether it's Swedish massage or shiatsu, I don't think will meet that quite well. I might change it up to sports approximation. I might throw reflexology in. I might throw certain types of traction type movements to release it, which creates space. I might throw in a low cranial sacral therapy, and usually it's just a mixture of everything based on what I'm feeling. And no massage I do is ever the same. It changes. But as far as reflexology, it's extremely effective for a myriad of conditions. I highly suggest that you do a massage in reflexology, especially if you have conditions. And it doesn't have to be severe conditions, but it's especially effective in severe conditions. But it creates harmonious balance throughout the body, homeostasis, which is uniformity throughout the body. It's an excellent technique that I highly, highly advise. Growing technique for many years. And you should try it because it will really bring uniformity throughout the body and connect, I guess we would say, all the dots of the body and go from one end to the other. And you'll walk out of a session feeling very relaxed, calm. You'll feel very balanced, and it's extremely effective. So anyway, that is my explanation of reflexology. I hope you enjoyed it. We will have many types of more explanations coming forward. I'm Dean Curry, President and Founder of Massage Terrific. Again, we are an in-home massage service based here in New York City. And until next time, I hope you have a wonderful day, a wonderful week. Go for your massages, and we'll have more and more to come. Have a wonderful day and week.